Hey there, welcome to our channel. Today, we're diving into a critical issue affecting global health, the improper use of antibiotics. Antibiotics have revolutionized medicine, saving countless lives by fighting bacterial infections. However, their misuse has led to a growing problem: antibiotic resistance. This silent threat is making once treatable infections harder to cure, posing serious risks to public health. In this video, we'll explore how antibiotics work, common mistakes people make when using them, and what we can all do to ensure these life-saving drugs remain effective for future generations. Join us in this campaign to raise awareness and protect our health and the well-being of our community. To make this campaign successful, we kindly ask all viewers to like, subscribe, and share this video with at least one person who can help us spread the word. Stay tuned to learn more about this important topic. The rise of antibiotic-resistant bacteria, known as superbugs, has become a major public health concern. As antibiotics have been overused and misused, new strains of bacteria have emerged that can withstand the effects of many common antibiotics. In this video, we will explore the consequences of limiting or stopping the use of antibiotics, and examine how this could impact the ongoing fight against bacterial resistance. We'll look at the mechanisms behind antibiotic resistance, and consider strategies for preserving the effectiveness of these critical medications. Antibiotics Definition. First, let's see what antibiotics are. Antibiotics are vital medicines used to treat infections caused by bacteria. The purpose of antibiotics is either to destroy the bacteria or inhibit their growth, according to World Health Organization, WHO. Antimicrobial resistance, AMR, is a major global public health threat, responsible for 1.27 million deaths in 2019 and contributing to 4.95 million deaths. The misuse and overuse of antimicrobials in humans drive the development of drug-resistant pathogens, making infections harder to treat and complicating medical procedures such as surgery, cesarean sections, and cancer chemotherapy. Antimicrobial resistance not only endangers lives but also incurs significant economic costs due to increased healthcare expenses and reduced productivity. How antibiotics work. Antibiotics target specific bacteria responsible for infections. They either kill the bacteria directly or inhibit their ability to multiply. This enables the body's immune system to fight and clear the infection effectively. Why you need to finish the course as per the prescription. Doctors always prescribe antibiotics for a specific period to ensure the complete elimination of all bacteria responsible for the infection. Even if you start feeling well before the duration lapses, finishing the course is of great necessity. Stopping antibiotics before the prescribed treatment period is completed can contribute to bacterial resistance for several reasons. Let's see the potential dangers of stopping antibiotic treatment prematurely in detail. 1. Incomplete eradication of the bacteria that caused the infection. Antibiotics are prescribed for a specific number of days to ensure that all the bacteria causing the infection are killed or reduced to a level where the host's defenses can easily remove them. The duration for which they are prescribed is also so important because it aims at killing the whole bacterial cell population, including the more resistant ones that may survive and replicate later on. Some bacteria will survive if you stop taking the antibiotics before the course is finished. These surviving bacteria are often naturally resistant to the antibiotic used. Having survived the initial treatment, they can go on to grow and multiply, potentially leading to yet another flare-up of the infection. Moreover, partial eradication results in the fostering of antibiotic-resistant strains of bacteria. These resistant strains are more difficult to treat. They may necessitate more robust, more potent antibiotics, potentially with far worse side effects than would have been necessary or appropriate if the infection was treated using the original course of treatment. You not only inhibit your health by not finishing an entire course of antibiotics but also contribute to a much broader public health issue: antibiotic-resistant bacteria. This resistance makes future infections more challenging to treat and hence decreases the effectiveness of antibiotics, a crucial tool in modern medicine for fighting bacterial infections. For this matter, it is essential that the fully prescribed regimen of antibiotics be completed even if signs and symptoms of a disease have stopped before the medication has all been taken. It is also because all bacteria must be successfully targeted, whereby should there be some remaining after treatment, they may potentially develop resistance, hence causing complications. 2. Evolving of resistant bacteria. When antibiotics are administered, they target and kill susceptible bacteria within a population of bacteria that cause the illness. However, not all bacteria are equally affected. Some possess genetic traits that grant them resistance to the antibiotics' effects. As the susceptible bacteria perish, the resistant ones have a survival advantage and are more likely to thrive and reproduce. If the antibiotic treatment is discontinued prematurely, even before all susceptible bacteria are eradicated, the surviving resistant bacteria can proliferate unchecked. This scenario creates an environment where the resistant bacteria have fewer competitors for resources, allowing them to become the predominant strain within the population. Over time, this can contribute to the spread of antibiotic-resistant bacterial infections, posing significant challenges for medical treatment and public health efforts. If you stop taking antibiotics too soon, it will cause some bacteria to multiply further since the amount of drug in your body has dropped below the effective concentration required to clear the bacteria from your body fully. Now, this incomplete exposure, the failure to get rid of all bacteria, leaves some still alive and multiplying. These surviving bacteria are exposed to sublethal doses of the antibiotic, doses not strong enough to kill them but sufficient to exert selective pressure from the antibiotic. In such pressure, bacteria may evolve and develop mechanisms of resistance to assure their survival in the presence of the drug. This, therefore, means that the next time antibiotics are used, these resistant bacteria will not be treated effectively, leading to more complicated infections and the spread of strains resistant to antibiotics. This occurrence plays a role in the overall issue of public health, namely, that of antibiotic resistance. It thus becomes very important that we complete a course of antibiotics as directed by healthcare professionals. If the surviving bacteria are resistant, they can reproduce and spread their resistance genes to other bacteria through horizontal gene transfer mechanisms such as conjugation, transformation, or transduction, as mentioned earlier. This can lead to a wider spread of antibiotic resistance. 3. Rebound infection. The infection could relapse if treatment with antibiotics is not entirely administered. The remaining bacteria that won't have been entirely eliminated with the therapy will have the potential to multiply and cause reinfection, usually at a higher level of illness severity than was the original. This could lead to prolonged illness, which may require other medical interventions. To prevent the development of antibiotic resistance, it is crucial to follow the healthcare provider's instructions and complete the full course of antibiotics as prescribed, even if you start feeling better before the medication is finished. This helps ensure that all the bacteria are killed and reduces the chance of any surviving bacteria developing or passing on resistance. 4. Spread of infection and resistant bacteria. Resistant bacteria could be passed on to others, another public health danger to worry about. These bacteria can give rise to difficult-to-treat infections, increasing hospitalization periods, raising medical costs, and leading to higher mortality rates. 5. Useful tips. 1. Follow instructions from your doctor. 2. Complete the course even when you start feeling better. 3. Do not share antibiotics with someone else. 4. Do not use leftover antibiotics. Conclusion. Completion of the whole duration prescribed for an antibiotic is essential in the treatment of infections and the combating of antibiotic resistance. By adhering to your doctor's instructions, you contribute to your health and the community. Use antibiotics responsibly. Thanks for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more health tips and information. Hit the bell icon to get notified whenever we upload new content. Leave your thoughts or questions in the comments below, and we'll be sure to get back to you. Take care and stay healthy.